So, good morning, everyone. Sadly, two more Albany County residents have died from COVID-19 since yesterday. There are two men, both in their 50s. That brings our total to 210 deaths since the outbreak started March 12th. My thoughts and prayers and condolences go to the two new families, and again, to the hard times that they're going through. It's a difficult enough time to lose a loved one, but more difficult in these tough times that we have and been going through these last 9.5 months. So, again, to the two new families, my condolences and prayers. But this is the 8th day in a row that I've had to announce a new death. Over this time period, we've lost 16 county residents. We're also seeing more deaths associated with younger residents. Back on October 28th, the age group between 50 and 74-year-olds accounted for about 24% of all of our deaths. This number has grown to 30% of all deaths, and we still continue to see that shift between the age groups of 50 to 74. Just to put a little light into it of what we've been looking at, Albany County number of deaths by month. December, this month alone, we've lost 50 Albany County residents. November, we lost 16. October, we lost 8. Back in May was our highest at 55, and then April was then the second highest at 49. And the month's not over with. And again, we're not trying to scare people. I know people said we're trying to put fear into people, but when you see this amount of people passing away and you look on a national level and you're talking to the health experts, when I'm watching them and reading this stuff from the CDC and the World Health and all the other outlets around this nation, and you see the fact that they're going to say January is going to be worse than December, that they're afraid of the amount of people that traveled. So TSA screened nearly 1.3 million people this past Sunday, a new record during this pandemic. The previous record was 1.19 million set on December 23rd. So think about the amount of people that have traveled. We've seen the highest numbers in these last 2 months. We were worried about Thanksgiving with the travel then. Again, COVID-19's here. It hasn't gone away. The vaccine's here. Dr. Whalen and her team are working with Dr. McKenna and getting the vaccine out to people, and we're putting things into place. And one of the things I can say is that we're looking at getting a lot of vaccine, and hopefully in the next couple days or the next week, where we can get mass shots out to everyone. But the issue is this: it's not here yet. We need people to continue to wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. Because unfortunately, these numbers are alarming, and they're going to continue to grow in the next couple weeks, because we have not felt the full impact of Christmas, and we have New Year's on Friday, and that's going to continue to make January. So if you don't want to believe me and the people that send me stuff on Facebook and they hate what I have to say and they want to disregard it, educate yourself. And that's why I continue to tell people, look at your news outlets here, look at the radio here, listen to people, watch it, do your own homework, and look at it. I'm just delivering the message. And I'm telling you, every health expert is scared as hell for the month of January of what our numbers are going to look like. And we thought November was bad. We set records. Then we're killing records in December. I am afraid of what's going to happen in January. And to the people doing the right thing, thank you. To the people that don't understand, who do the right thing and get it, I can't explain it either. This thing morphs, it changes, and I feel bad when people say, I've isolated, I haven't seen people, but yet I got it. Can't explain it. I don't know. The false positives that people get, or they come up positive and they're really negative, and then they do the PCR. Like, we're all learning and adapting to this. And again, that's why I continue to say it's a marathon, not a sprint. We need to take a step back and just relax, take a deep breath. Be part of the solution. Stop being part of the problem. If you don't like what I do every day, don't watch it. I don't know what else to tell you. Go get your information somewhere else. But what we do today will define who we are 9 months from now. How we handle this stress in our life in this new world we're in is going to define us. And there's so many other issues that we work on, from mental health to suicide rate. I know another friend that just committed suicide yesterday, and I have to tell you, it's alarming, because it is going on. The opiate overdoses, people going back to substance abuse, people struggling in this new world we're in. And people who didn't have mental issues have mental issues now. We can get through it together, leaning on one another and reaching out to people and just being kind. As of today, there's 10,998 cases of COVID-19 in Albany County. We have an increase of 240 positive cases since yesterday. Yesterday, we saw an increase of 236, and the day before that, we saw an increase of only 156, which was a great number, we thought, but it's really contributed to people being shut down Christmas Eve and Christmas Day, and not no one be able to get testing. So that's why that number was so low. There are currently 3,126 people under mandatory quarantine. Of those positive cases, 25 had close contact to a positive case, 6 are healthcare workers or residents or group settings, 208 don't have a clear source of infection. So that falls into 2 categories. So I know we keep getting this question. One is the fact that they don't tell us who they're with. They're not being honest. And some of it is that they just don't know. And that does happen, you know. And again, the amount of people that we are investigating and doing the epi, it takes time. And as I said, people, please be patient. We have more people answering the phones. I dialed it last night myself at 9 o'clock to see how it works because we were getting complaints. And I called during the day today too. And and the woman who has my cell phone number, my private number, please lose that in the county. I forgot that it shows up. But again, I want to see how it works. And again, we're not perfect. If there's something we can do better, please, by all means, let us know. So over the last 5 days, there's been an average of 197.4 new positive cases. Yesterday, it was 223.2. And as of today, 36,218 people have now completed quarantine, 9,451 tested positive for the virus, and have recovered. Yes, we are seeing big recoveries. That is the great side of the story. So, yes, we do put that out there. I know people think we don't. So, again, 9,451 people tested positive for the virus and have recovered. Also, we've seen people that were positive who had this and now are positive again. So you can get it back, even though if you have the antibodies or whatever it may be, people have gotten sick. And I talked to a friend of mine that got it again the second time. So that's an increase of 199 recoveries since yesterday. And the other alarming thing that we continue to trend and watch is the hospitalizations. 17 new hospitalizations overnight. There are now 127 people currently hospitalized from the virus. Unfortunately, we set another record today. This is the 3rd day in a row that we set new records for hospitalizations. Yesterday was 118, and the day before that was 116 people in the hospital. We've had over 100 residents in the hospital because of the virus at one time for 13 days now in a row, higher than we've ever been in the last 9.5 months. I hate to say that, it's almost going to be 10 months that we're going into this. We've talked about the percentages of hospital beds and ICUs. Unfortunately, there's 21 patients that are still currently in the ICU. Yesterday it was 22. The day before that was 22. We continue to monitor in the Capital Region's hospital capacity or hospital beds, and roughly the hospital beds I think went up a little bit. They're at 26% today, but our ICU bed space is still below 19%. And during yesterday's briefing, the governor highlighted the percent positive rate for the Capital Region. As a region, we basically tied with the Finger Lakes at roughly 8.5% for a 7-day average. That means we tied for the second highest percent positive rate in the entire state. And the only region with a higher rate in ours is the neighbors to our west, the Mohawk Valley. Their 7-day average was higher than ours. As of December 27th, the region's single-day percent positive was alarming at 12.7%. Again, that puts us just below the Mohawk Valley at 12.9%. And when you drill down the counties, as you can see on the board here, Albany County's 7-day average is 8.6%. But most recently, our single-day rate was 15.5%. It looks like Albany, Schenectady, Rensselaer, Greene County really are driving up these percent positive rates here in the Capital Region. I would move on from the micro cluster zones. It doesn't seem like that's really going to affect us, so I don't want to get into that. It's really our hospitalization beds. I can't answer them questions to anyone on Facebook anymore that sends us questions or emails. Really, I think this region as a whole, as the governor's been looking at us in the Department of Health, is going to be based on our hospitalizations and our ICU beds and the capacity of what we can do going forward. I have had many conversations with the second floor, with two gentlemen in particular about, not just the hospitalizations, the vaccines, and other topics that we've talked about. So it is something we're looking at, expanding hospital beds and capacity going forward, and residents for nursing homes too. So again, these are things that are constantly being discussed to move forward. We still haven't seen the full effect of the holiday gathering and the infection rate that it's going to have going forward in the next week or so. So again, I will sound like a broken record, and I will urge everyone, please wear a mask. Please wear a mask, yes. I'm not going to argue. I know there was a certain senator, I don't even want to mention his name, from Florida that was arguing over masks. If anything, it's kept down the flu season, which is a great thing. So look at it that way. It is helping, but it's one of many arsenals in the tool shed that you should use to make things happen, right? And it's not just wearing the mask, coughing in your arms, cleaning your hands, staying 6 feet apart. It's really doing all these combinations and other things, and cleaning surfaces and making sure that everything's that you can control to keep you healthy and safe. So there is a variety of things. It's just not one fix for this COVID-19. There's many things that you can do to help yourself. So please continue to wear the mask and do the right thing. Yes, I've been out and I've walked in the store and I've seen people with no mask on. I was just talking to Sheriff Apple about this yesterday. I'm not same thing with him, and people just want to challenge us. Listen, please, that's why we have the mental health hotline. Call there. And I'm not trying to be a wise person right now. I'm just saying call there. I know people are stressed out. I know it's hard for them to deal with things. That's why that number was established on day 2, to really give you someone to talk to. And again, I say to the people watching this or listening to it, don't challenge people that you see like that. It's hard enough on the store workers that are working in these establishments, because people define them too, and what are they supposed to do? They're just trying to make a living. They're trying to go home safe to their loved ones. They're trying to just put food on their table and pay their rent or their mortgage or just whatever while they're there working. They just want to go home and be safe. So please, think of other people if you can't think of yourself. And we are in this together, and we'll get through this together. If you missed it, last night I announced I had officially amended the December 14th emergency order, capping the third-party delivery fees at 15%. After I did that, restaurants reached out to me, and one thing I learned, not that I'm the big IT person, so get your chuckles, the third parties really capture the restaurants in menus and websites, and when you go there, you actually think you're ordering from Savoy's or McGarry's or Normanside, wherever or Martell's, you think that you're ordering from there. And it really has nothing to do with them. It's this third party, and you order the food from them, then they place an order, and they're charging you up to 30% on top of that. So once we figured that out, what they were doing, and we heard back from a lot of these restaurants, I amended it, the order affected immediately, to help bring that down, to help these businesses that are struggling, even just to pay their workers or keep their lights on. So after hearing from all the business owners and talking to people, we have to do our job and work together. I was hoping the state legislature was going to address this yesterday when they're in town. This is something that should have been addressed on a statewide level, not county by county. But again, we're not trying to hurt the online food ordering companies. We just want you to charge people correctly and let the restaurants, who should be making more profit, make the profit, and stop this gouging that they're doing. So again, the emergency order will amend. The emergency order caps the market and other fees at 5% instead of 30%, because again, most of them are charging between 20 and 30%. So this takes effect immediately. I have talked to Chairman Andrew Joyce in his office. and Matt Peters and everyone else that was on this bill, and Dennis Feeney, and they're going to amend it to match what my emergency order is, and that's only good for 5 days. So every 5 days I have to re-sign it until the legislature passes it. So I can't thank them enough for the partnership and caring about restaurants and local businesses here in our community. And if you want, I want people to stay home. I don't want you out. But you can support your restaurants. You can buy gift cards, and you can order out food and either pick it up at curbside or have it delivered. So please continue to do that. So one of the best tools we have is to get tested, and I'm encouraging people, please go out and test it, whether you have signs or symptoms, go out and get tested. I know, listen, one thing I've learned from the holidays, everyone went out and got tested because they just wanted to be with loved ones, and they figure if they're negative, they could gather and be together, and it's hard, and I've gotten into some debates with my own family. That just because you're negative or you got tested doesn't mean that you can get together, or because you had it, you can get together. And that's why I kind of said you don't have that S for Superman on your chest to sit there and go, now, hey, I can't get it anymore. I have the antibodies, but you still can infect people. So you still need to wear your mask. You still need to do the social distancing. No, and I will say this to everyone, it's where I get my information is through the Department of Health, through Dr. Whalen's team, and through the other resources, and through County Executives America, where I sit on as president, and the discussions we've had with the White House and CDC and everyone else that feeds us. And it's changed. What we said 9 months ago has changed, and that's what I said. This virus changes at that time and place. They were the right decisions, but as you learn more stuff as you go forward, they changed the guidelines. They changed different things from 14 to 10 days for quarantine, because we're learning, and as we learn, we evolve. So please educate yourself. So please, again, make appointments with Whitney Young. We're at the Times Union Center, Waterville Lee. Testing sites are set up. Area code 518-465-4771. It's free if you don't have insurance. We pay for it, and please show up there and get tested. UAlbany is also free to the people that got high co-payments. Your health care is between you and your employer, and I know some people that say it's very expensive for them to get tested. Go to UAlbany, it's free. Go to Whitney Young if you can't afford it, it's free. So there are options out there. I was kind of surprised that some of the pricing that people were telling me, I don't know if it's true or not. I don't know how your health care is set up, but it was really alarming to me how much money people were paying to get testing done. Their copay. So I understand why they can't. Go through Albany. The Governor Cuomo set these up throughout the whole state, and you don't have to worry about a copay. So that number is 188-364-3065, as always. And again, our partners with UAlbany, Price Chopper, CVS, Priority One, Walgreens, and plenty others. Rite Aid, again, is now testing kids over up to the age of 13 and above, which is good. And always go to our website, albanycounty.com, to get the full listing of age requirements, what you're looking for your children, and time waits and where you can get it. And again, be patient. Waiting 45 minutes or an hour and a half to get a rapid test is not too bad. Driving through UAlbany and being in and out in 15 minutes. I know we're a society that wants things right away, but be patient when you walk in there, and we'll get through this. Again, our mental health support line is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. United Way 211, and the New York State hotline. As always, call that number. And again, we're hopefully what we're working on today with the vaccine and what we're hearing and getting ready for, we'll hopefully have more announcements in that and getting it out quicker to the people. But that evolves and changes every second of every day, so I don't want to get hopes up for anyone. Please continue to do the right thing. Wear your mask, socially distance, and we'll get through this. Thank you, everyone. Stay safe out there.